Bismillah, alhamdulillah, wassalatu wassalamu rasulillah. Rabbi shrah li sadri wa yassir li amri wa hlul uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. It's been some time since I've done a video. Obviously, what's happening in Palestine has affected a lot of people. May Allah subhanahu wa ta'ala grant the Mujahideen victory and destroy the enemies of Islam. Allahumma ameen. I wanted to just speak about the long-term psychiatric and psychological impact that the genocide will have on adults, on children, and on healthcare workers as well, subhanallah. So the graphic and terrifying images and videos that we are seeing on a daily basis of parents picking up their children's limbs that have been smashed to pieces by bombs and vice versa. This is the physical impact, kids having to be amputated without anesthesia, third, fourth degree burns, severe burns, long-term physical health issues. So these are all the physical things that we see, and it's obvious that pain and suffering will affect children and adults and healthcare workers. But the hidden problem, which needs to be addressed, inshallah, after this brutal genocide is over, is the psychological and psychiatric impact, because they last years, if not decades, if not for the rest of the lives of individuals involved. And usually this manifests as a post-traumatic stress disorder with nightmares, with hypervigilance. So people reliving memories of being bombed and losing their children and parents, what we call autonomic symptoms, sweating, panic attacks, severe anxiety, depression, suicidality. That can then have a knock-on effect in terms of substance abuse, so people drinking alcohol, using heroin and other drugs, cannabis, to block out these painful memories that they've experienced. Even aggression, domestic violence, all these kind of things, attachment problems, so children who've lost their parents, their primary caregiver, obviously if they're not brought up in an environment which nurtures their psychological development and mental well-being, they can have significant problems with conduct, antisocial behavior, kind of lashing out. So these are some of the things that we need to worry about. And also, subhanallah, I was actually listening to Professor Ghassan Abu Sitta, who's a surgeon from the UK who was working in Palestine. May Allah subhanahu wa ta'ala bless him, and all the other nurses and doctors and healthcare workers, paramedics, who are working in such difficult circumstances. And you could see in his eyes when he was talking about individual patients, particularly children, where he had to treat them with severe burns, even without anesthesia, do amputations, and he was literally crying. So the other thing is also to think about the individuals who treat these patients, this long-term psychological harm that they will experience as well. So as an ummah, we need to focus on the rehabilitation, psychological and psychiatric rehabilitation, as well as the physical, and this needs a holistic approach. Children often do well with things like art therapy, so drawing is very healing for them, pottery, so non-verbal kind of interventions. Family interventions also very important. For those who are orphans, they need a nurturing environment if possible. I mean, subhanallah, generations have been wiped out. So I don't know, subhanallah, like what is the provision in terms of orphans, because that is a serious issue. It's been going on for a long time, but particularly right now, it's going to be a big challenge for healthcare system in Palestine and Gaza to deal with these issues. So may Allah subhanahu wa ta'ala bless you all, make dua for them, and if anybody is in Gaza, they need help, or if anybody has contacts and they need psychological, psychiatric help, please do get in touch with me. Inshallah, I am a child and adolescent psychiatrist specializing in addiction as well. So I'm happy to, inshallah, for the sake of Allah, fi sabilillah, support our brothers and sisters as much as possible. May Allah subhanahu wa ta'ala bless all of you. Until next time, Assalamu alaikum wa rahmatullahi wa barakatuh.